Good evening, friends. A very warm welcome to everybody to the Department of Medicine academic breakfast, it's called, but now it's actually lunch. Um, we are very honored today to have Dr. Superb Mishra, who is joining us to give us a talk on nanotechnology and its use in medicine department. So welcome, Dr. Mishra, and thank you very much for accepting our invitation. CMC is very honored that you have accepted our invitation. Thank you very much. I would like to give a brief introduction of Dr. Mishra. Dr. Superb Mishra finished his graduation in mechanical engineering from the University of Manchester and his PhD from Imperial College London in the field of biomaterials. His research focus is on novel materials for use in biomedical and environmental applications. And his research explores the realm of fundamental sciences governing the response of nanomaterial in a given environment and also making engineering applications of nanomaterials. So you may wonder why we're having a talk on nanotechnology in medicine. Well, it's the right time actually. Everybody's talking about nanotechnology for vaccines, for drugs, for so many things on COVID. And the future of medicine, somebody has called it now a hybrid doctor. A hybrid doctor is somebody who knows MBBS medicine, at the same time has some other skills to bring to the table. It may be engineering skills, it may be administrative skills, it may be IT skills, it may be informatics skills. So I think this is a really good opportunity, especially I hope our younger postgraduates are listening in. Some of you may want to have a project later on with Dr. Mishra on nanotechnology in medicine, or you just explore the possibility of going and working for some time in his lab to see what it's all about. So I'm hoping this will enthuse not only just our postgraduates, anybody listening in the audience who would like to get in to have an idea of nanotechnology, and if you've got some ideas to collaborate in future. So we're looking forward as this as a starting point, a sort of a spark to work with Dr. Mishra in the future. So once again, Dr. Mishra, thank you very much for accepting our invitation. And without much ado, I'll ask you to take on. And we'll have questions in the chat box. Maybe at the end of the session, we can take questions rather than during the, if that's okay with you.
Dr. Thambu, thank you very much. Am I audible to everyone?
Yes, yes, yes.
Okay. So, Dr. Thambu, thanks again for introducing me, my research, and also giving a platform to the field of nanomaterials and its relevance. I'll also thank Dr. Mohan, who has been helpful in coordinating this from the beginning. So, thanks to both of you guys. Well, welcome to all of you. I'm going to make this more of a discussion. The reason is because we are used to teaching in the classroom, and I think I don't have anything to teach you guys. You're already aware, you already know more than me in the field of biology. So I'll make it as a discussion, and if you have any points to talk about, if you have any clarifications, as Dr. Thambu mentioned, please write it in your chat box and we will try to address it later on. Okay. So let me start the session. Just let me share my screen. Just give me a sec. Okay, so I think my screen is visible to all of you guys now.
Yes, sir.
Okay, perfect. So, I'm currently at IIT Gandhinagar, and my email ID is mentioned over here for you guys to take a note in case if you want to get in touch with me. In today's talk, what we are going to discuss is a little bit about nanomaterials and their biomedical applications, and keeping in mind the concept of nanosafety, because at the end of the day, whatever we are doing, the primary assumption is that it should be safe. While it is doing its intended job, safety is something which cannot be cornered or which cannot be compromised at any level. So that's something which we are going to focus on also. So just a quick reassurance that the field of nanomaterials and the field of nanosafety or biomaterials, whichever way you want to look at, is not something which is a cozy club which to which only certain people of a certain background have privy to. This is a field where you would find people from physics, mathematics, computer science, electrical engineering, biologist, chemist, physicist, all of them actually having a major say. So in fact, if anybody wants to work in the field of nanomaterials, nanotechnology, you don't need a prerequisite background. The background which from where you come from is good enough as a starting to work in this area. So it's an open for all area of research. Okay. So let me start straight away with nanoparticles and nanomaterials, and let me just challenge you guys straight away by saying that nanoparticle is actually an old word. Nowadays, people are talking about something which is called as ultra small nanoparticles. Okay, so if you look at the length scale regime, nano word in itself does not really have a big significance. It just says that if something is in nano, that means that it's something within a particular dimension. Um, so if you look at this length scale, we started with bulk, then we went into nanoparticles, then we go into ultra small nanoparticles, and then we go to molecules. Now, as I mentioned, that the length scale in itself is not really a big game changer. But what the game changer is the properties which are associated when you reduce the size. So when I say that if something is at a bulk level and I bring down the size of that material all the way to a molecule level, what is the changes which you would expect in the property? That's very important. And over here, we would also like to talk about that what is that size dimension from where you would expect the properties to change. So I'll give you a couple of examples. So let's say if I talk about a conventional quantum dot. Quantum dots are basically those type of nanomaterials whose quantum confinement is exploited to get right type of optical properties. Now, the quantum confinement is very much visible or very much exploited within a very small size range. So once you go above that size range, you really are not utilizing that quantum confinement to that extent. So for example, if you talk about cadmium sulfide, cadmium selenide, or any of these chalcogenides nanomaterials or quantum dots, anywhere between up to, let's say, 20, 30 nanometers, you would see that quantum confinement being very actively used. But when you go to 80 nanometer, 90 nanometers, 70 nanometer, 100 nanometers, you actually are not exploiting that much. So would you still call it as a nanomaterial? Now compare this with, let's say, if you take gold, and if you reduce the size of gold from its bulk 1 micron size to, let's say, 100 nanometer, 80 nanometer, you'll start seeing that the gold is actually behaving in a very different manner. Now, what is this behaving different manner mean? So for example, let's say if you have a gold nanoparticle, which is ideally inert material, that's why we buy ornaments made up of gold, because it's not reacting. But when the size reduces all the way to 20, 30 nanometers, even 50 nanometers, it acts as a catalyst. So we are seeing that the property change happening in the case of gold anywhere from 80 to 100 nanometers. Now, this size thresholding is very, very important because not all the properties are affected equally by this size thresholding. Okay. So now let me read through the slides a little bit. So nanoparticles exhibit size-dependent properties, whether it is superparamagnetism, whether it is quantum confinement, whether it is catalytic properties. And the reason why these things happen is because when you reduce the size of a particle, what you effectively do is that you increase the specific surface area. Of course, you don't increase the surface area because surface area is directly proportional to the radius. So effectively, if your radius is increasing, your surface area should increase. But what happens is that as you reduce the surface area, the volume also starts reducing, and the specific surface area starts becoming higher and higher. So if you now look at this slide, you would realize that I've got this new word which is called as ultra small nanoparticles. And ultra small nanoparticles are actually those nanoparticles whose dimensions are between 1 nanometer and 10 nanometers. Now somebody would say that, why are we really going in that realm? If nanoparticle is doing the job, why should we try to reduce the size more? Well, in the next slide, we'll see the answer to that. So if you look at this slide basically tells you a plot between the diameter on my x-axis and the percentage of atoms on the surface on my y-axis. Now, what it tells me is that if my particles are getting smaller and smaller, the proportion of atoms which are at the surface becomes higher. In other words, most of my atoms which are contributing are at the surface if I reduce my size. But if I start increasing my size, then what is happening is that I'm getting more and more number of these atoms shielded at the core of my sphere. If let's say I take sphere as an example. So in other words, those things which are sitting at the core is not really participating in anything, because remember that when we talk about reactivity, when we talk about why nanomaterials are very, very interesting, you really focus on the surface atoms. So by reducing the size, what we are doing is that we are ensuring that the surface atoms are predominantly present as compared to the bulk atoms. Okay. Now, somebody would say that, so what is the big deal? Why would you want more amount of atoms or the percentage atoms in the surface to be higher? Now, here comes the trick. So before I tell the trick, let me just read out one stats over here. This is an important stats. So for example, if you have a 1.2 nanometer particles, for a 1.2 nanometer particles, 76% of the atoms are in the surface. Now, if you increase that size from 1.2 nanometer to 2.5 nanometer particles, what you see is that the drop happens in the percentage of atoms on the surface, and that goes to 45%. So this just gives you an idea that by increasing the size, well, in this case, almost doubling it from 1.2 nanometer to 2.5 nanometer, you're seeing a significant reduction in the percentage of atoms which are present in the surface. And if you try to reduce the size of the particle below 1 nanometer, then the particles are almost completely made up of molecular dispersion. Now, I said to you earlier that what is the big deal? Why do you want to reduce this size? So let me give you an example. Let's say if I have a particle which is made up of gold or silver, or you can take any. For the sake of convenience, let's say if I have gold. So when I make these gold nanoparticles, I can make it with the help of different molecules. Okay. So I can have, let's say, a molecule in the form of amine. I can have the molecule which is used in the form of thiols. I can have molecules which are in the form of carboxylic acid. Now, what these molecules do is that these molecules arrest the growth of a particle. So when we say that we are making particles smaller and smaller, effectively what we are doing is that we are not letting that particle grow when we are synthesizing. Now, the way you arrest the growth is by using different capping agents. Now, these capping agents have different surface chemistry. So I gave you the example of it can be in the form of amines, thiols, carboxylic acid. Now, if predominantly my particles, atoms are present in the surface, so now let's say if I have a 1.2 nanometer gold nanoparticle, which is capped with a thiol versus, let's say, a 1.2 nanometer gold particle, which is capped by an amine, they both are going to give me a very, very different behavior. Even though the particle is made up of gold, but because the functional group which is present in the outer end is composed of a thiol or an amine or a carboxylic acid, and I know that 76% of the atoms of this material are present in the surface, so even though my core material is made up of gold, but actually it's not going to behave any similar. They're going to behave very, very different. So that's the reason why people would like to reduce the size as much as possible so that you can actually make these particles behave differently by changing the surface chemistry of these particles. So that's the holy grail why nanomaterials or nanoparticles are extensively being used. Okay. So nanoparticles in general can be used for various applications. One could use it for as a protective agent. One can use it for targeting to a particular tissue or a cell type. One can use nanomaterials for controlled release. It could also be used for a combination of modalities. So for example, nowadays, we might have heard about theranostic devices, or we have talked about dual combinatorial therapy. Combinatorial therapy is wherein my carrier as well as my payload both are doing the job. So in other words, if we take a capsule, um, if you try to open it up, that's where your drug exists. The intention of the capsule or the outer layer of the capsule is just to make sure that the drug reaches its destination. Okay? But what if it plays an active role? What if it just does not play a passive role? That's where we talk about combinatorial therapy, and combinatorial therapy utilizes nanomaterials quite extensively. Nanocarriers can also be used for elimination. So for example, if we want to eliminate certain toxic chemicals from the body, we can design a nanomaterials which can specifically go and bind to these chemicals and then cause an efflux from the body. And of course, we can also use nanocarriers for better formulation of drugs, better formulation of anti-cancer agents. Now, in terms of the nanomaterials compositions, effectively, we can have nanomaterials in different forms. It can be a inorganic-based nanoparticle. It can be an organic-based nanoparticle. When we talk about inorganic-based nanoparticle, there are various sub-classifications. So, for example, we have something which is called as upconversion nanoparticles. Upconversion nanoparticles are those nanoparticles which get excited at a higher wavelength and emit at a lower wavelength. Okay, it's very counterintuitive to what we have normally studied. It's the other way which we have studied. But over here, the reason is because the excitation is a 2-photon excitation process. So this is a very good example of something which is called as photodynamic therapy. Okay. If any of you guys are interested in that, we can talk about it later on. Similarly, we can have a silica-based nanocarrier. Silica is a very benign material. It does not react and it does not have a very carcinogenic effect in the body. So silica-based materials are often used for drug deliveries because you can create a lot of surface area for silica-based nanoparticles in the form of having mesoporosity. And you'll see a lot of drug formulation uses silica nanocarriers as a payload or as a vehicle for drug delivery. We can also have things like plasmonic nanocarriers. That's where we utilize the plasmonic ability of a plasmonic resonance of gold. By changing the shape of the gold nanoparticles, you can exploit that. Similarly, we can use something which is in the form of magnetic nanocarriers. So there is a term which is called as hyperthermia. Okay, so hyperthermia is quite a lot used nowadays for treating cancers, wherein what we do is that we apply a very weak alternating magnetic field, combining it with electrical and magnetic field. And both of them, what they do is that they causes these magnetic nanoparticles to generate heat. And by controlling this alternating magnetic field, you also control the amount of heat that is generated. And this heat which is being generated is actually useful for burning up of cancerous cells. Similarly, we can have semiconductor nanostructures, and we'll talk about what is the relevance of semiconductor nanostructures later on in today's presentation. Now, if we shift to the organic regime, you can have lipid-based nanocarriers, we can have polymeric nanocarriers, and we can also have carbon-based nanostructures. So depending upon the application, one may try to pick up a suitable nanocarrier for their intention. Now over here, I'm going to give you some examples of controlled release. So for example, if you look at the slide on the right-hand side's images, over here, what we are doing is that we are utilizing a nanoparticle or a nanomaterial purely from its drug delivery perspective. Now, from a drug delivery, what we have to keep in mind is that we need to really control the rate of this drug release. We do not really want the drug release to happen in a very burst manner, which means that 95% or 90% of the drug is released instantaneously. That is not really a drug delivery vehicle which we are talking about. So drug delivery vehicle is where you can actually control the release rate to the extent that it could even be triggered by an stimuli. So for example, my drug is not going to come out from these nanoparticles unless and until there is a very specific pH or I am introducing an external stimuli to burst open the release. Till then, my drug is going to be intact. So that's an example of a stimuli responsive release. But even if we do not go to the stimuli response release, we can actually control the rate of degradation of these nanoparticles, and that rate control will allow me to control the rate of the release of the drug. Okay? So this is one example wherein we can use photodynamic therapy, we can use photothermal therapy, we can use magnetic response-based therapy. These all would utilize some aspect of the materials or the nanomaterials which are being used. So for example, when we're talking about magnetic-based therapy, then we are talking about ferrites, so Fe3O4 type of system, or doped Fe3O4 based system. When we are talking about photothermal therapy, then we are talking about gold-based material. When we're talking about photodynamic therapy, when we are talking about the reactive oxygen stress-based response also. So how complex is this engineering nanoparticles? Because now what I said to you earlier is that the properties of the nanoparticles is something which we utilize to use it for an application. Now, is it to say that we are confined by the choices of nanomaterials? Well, the answer is no. If our nanomaterials is considered as safe, then we can play around with that nanomaterial. So we can play around with things like its size, its shape, the charge which it carries, what sort of coating or layer or the surface chemistry we are using, what sort of payload or what sort of cargo it is carrying. Is it carrying an cargo for just purely affecting the cytotoxicity, or whether it is going to the gene level? Are we carrying those kind of payloads? So depending upon what our application is, we can actually control these various physicochemical parameters. And controlling these physicochemical parameters has a knock-on effect, which we are going to study later on in terms of what those knock-on effects could be. So let me talk about this structure-activity relationship, because this is very important. The reason is, as I said earlier, that when we are designing a nanomaterial, one assumption is there that the nanomaterial is supposed to be safe. Okay? Whatever is the purpose, it should not really cause any unwanted response. Now, in order for us to decide that, we have to understand what are the responses which can happen. Because once we know what responses the nanomaterials could trigger, then we can actually mitigate that. And that really takes us into the realm of safety by design, which we'll not really talk about in today's session, but if any of you guys are interested, we can talk about it later on. So let's look at what are the pathways through which my nanomaterials could actually consider or can elicit damage to my cells. So one of those pathways is reactive oxygen species, or redox activity. Now, particles or materials like titanium dioxide, copper oxide, cobalt oxide, they have the potential to generate these reactive oxygen species. Now, these reactive oxygen species generation can, in some cases, be triggered by sunlight. It can be triggered by dissolution, but nevertheless, they have the potential to generate this ROS. And this ROS is something which is harmful, or which can be harmful to the cells. Similarly, the ability of materials to dissolve. Now, nanomaterials is a little bit challenging, because if we look conventionally, the biological response of ions is something which is well studied, and the biological response of bulk material is also well studied. Nanomaterials fall somewhere in between, and that becomes a little bit tricky. Can we categorize it to a particulate bulk matter? No. Can we classify it into ionic? The answer is no either. So it sits somewhere in between. So does it have the ability to keep on releasing these ions? If so, then we can basically try to understand or try to take a cue of what the biological response of that material would be. And in today's presentation, we might talk a little bit about those responses also. Similarly, surface charge. If I'm having, let's say, a polystyrene particle or any particle, and if I alter the charge of it, so instead of making it positively charged, can I make it negatively charged? Would that affect my uptake, or would that affect my cellular response? And in some cases, yes. The next aspect is something which we have heard about, it's called as aspect ratio. So asbestos was very, very notorious because when asbestos was being used, we did not really see a lot of its carcinogenic response, but when you give it enough time, it really manifests into these carcinogenic responses, and that is primarily happening because of its very unique aspect ratio. Aspect ratio is basically a parameter which is deduced by taking into the largest and the smallest dimension of a material. Okay. So, for example, if we can create carbon nanotubes which has similar aspect ratio to asbestos, then it can generate fibrosis, or it can actually damage the cells. Similarly, we can also have an inflammatory response. We can also have a photoactivating response. We also have the ability for these nanomaterials to actually prohibit the reproduction ability of a particular organism. So over here, we are looking at the embryo hatching interference, which some of these nanomaterials use. And lastly, we can also talk about how these nanomaterials can actually rupture or lysate a cell membrane. Okay? So these are several of these pathways through which nanomaterial can cause harm. Now, if we are in the realm of using these nanomaterials for an engineering application, we would exploit one of these pathways. Okay? But if we are trying to make a nanomaterial safe, then we would try to mitigate one of these pathways. So it's basically depending upon which side of the application you are, you would like to exploit it or you would like to mitigate it. Okay? So now let me talk about one of the a simple example of how challenging a nanomaterial could be. So for example, let's say if I take a nanomaterial X, for example, we can take, let's say, silver or copper oxide or titanium dioxide. Now, these nanomaterials do not exist in isolation and they do not exist in vacuum. So they always are interacting with some sort of fluid. And for the purpose of all of you guys, let's say that that fluid is biological fluid. Okay, it could be your lung lining fluid, it could be your blood plasma, it could be your saliva, it could be your lysosomal fluid. The particles, once they enter inside the body, they are going to interact with this fluid. Now, once it interacts with the fluid, a lot of things can happen. For example, these particles can actually agglomerate, or these particles can stay suspended, or these particles can actually start dissolving. Okay, these are the three possibilities which can happen. Now, once these things are happening, it is also going to interact with the media components which are present inside the body. So, for example, we know that our body is rich with inorganic as well as organic composition. So for example, when we talk about organics, we know that the body is full with proteins. And these proteins can actually have a very strong binding with the nanoparticles. Similarly, from an inorganic point of view, we know that sodium and chlorine is quite abundantly present inside the fluid. So what will happen when my materials react with this sodium or chlorine? So for example, once your exposure happens, then these nucleation or suspended particle or the dissolved component can further interact with the media components. And what you can get is, you can get a suspended particle, or you can get a complexation which happens. So a good example of complexation is, let's say, if I have a copper oxide particle and this copper oxide dissolves, so what I get is copper ions and oxygen. Now this copper ions, what they would do is that they would further go and look at the media's composition, and they might form a copper chloro complex. It can have a copper hydroxide. It can have a copper organic complexes. And now this complex is going to be very different from what your starting material is. Now, up till this point, it's pure chemistry. Biology is not really coming into picture. Where is biology going to come into picture? Is that depending upon if my particle is well suspended, or it is free ions, or it is complexated, my clearing mechanism is going to be very, very different. So to give you an example, let's say if my particle is forming an agglomerate, and it's staying in my system, then my cells can actually have a very phagocytotic response to that. As opposed to, let's say, for example, my particles are not really forming agglomerates, but they are forming suspension. So which means that the size is much more smaller. So over there, I can have any of those Cavalier mediated endocytosis or clathrin mediated endocytosis, depending upon what are the physicochemical parameters of these particles. But let's say if I look at the other spectrum is that my particles are actually dissolving. Now, if my particles are dissolving and my copper oxide is releasing copper ions, then what I'm saying is that a new channel, which is the ion channels, are now suddenly available for my internalization of the composition or the internalization of the constituents. So my copper oxide particles are too big to be pumped across the cell membrane through the ion channels, but the copper ions they can actually get through the ion channels. So depending upon what sort of reaction or what sort of output your material has undergone after reacting with the composition of the media, you can have a varied cell response. And in today's talk, I'll actually talk about some of those responses also. So if you look at these nanoparticles over here, I've talked about silver nanoparticles, how you can actually control the shape of the silver nanoparticles. And somebody would say that what is the relevance of that? Well, if you control the shape of the silver nanoparticles, you can actually control the internalization of these nanoparticles inside the cell. So if you're looking at it from an application point of view, you can actually determine the cubes might undergo a better internalization as opposed to the rod-shaped silver nanoparticles. Just let me check what the timing is. 15:05. Okay. So this was an example where I talked about how the nanoparticle surface is very important, because I can have specific ligands which are associated with these particles. So for example, if you look at the first figure, which says that I have a gold nanoparticle, and if a gold nanoparticle, I can create it by having a citrate capping, a polyvinyl pyrrolidone capping, or a CTAP capping. All these three cappings are going to have a very different response. Even though my particle is gold, but by changing the surface chemistry, I'm actually getting very different responses from the same gold nanoparticle. But somebody would then say, why bother? Why can't we just have different particles? Why are you fixated with gold? Well, the reason is because the gold is a benign material. The gold is biocompatible. The gold is not having any cytotoxic response in itself. So that's why we don't want to change that model. Now, similarly, we would actually try to create a lot of particles to be stabilized. So this is something which is used a lot in pharmaceutical industries. If your drug or if your molecule is not really suspended in water, what we do is that we do some sort of charge transfer for allow a better suspension of the drug in an aqueous media. And that is achieved again through changes in the surface chemistry. So for example, we can do pegylation. Pegylation actually enhances the dispersion ability or dispersibility of a material in an aqueous environment. Now, this is a very interesting example, which I think I should talk about a little bit. So over here, what we are showing is that we are showing a transmission electron microscopy image of silver nanoparticles. And this silver nanoparticle is not really a silver nanoparticle when it goes inside the body. The reason is because if you look at the surface of the silver nanoparticles, now silver is known to dissolve. So what happens is that from the surface, as soon as this particle comes in contact with a fluid, it will release a silver ion. Now this silver ion is an unstable material. It will try to immediately complexate with something. Now, if there is a presence of chlorine, we know that silver combines with chlorine and creates this silver chloro complex. But if there is even the presence of sulfur, the silver can also combine with sulfur and form silver sulfide. Now, what happens is that as soon as a silver ion comes from the surface, it will form a complex and then it will reprecipitate on the surface itself. So when a cell sees the silver nanoparticle, it does not really see silver zero valent, Ag0. It actually sees a mixture of various surface chemistry. There can be Ag0, there can be Ag plus, there can be AgCl, there can be Ags, and effectively, depending upon what my environment is, the same silver nanoparticle can have a very different response. And someone might say that, are you really testing the response of silver nanoparticles? Or you're actually seeing the response of silver sulfide or silver chloride complexes? And that becomes very murky and that becomes very tricky. So for example, over here, we see that the TM images shows the particles of silver nanoparticles, and then suddenly there is a bridging which is happening, and this bridging is happening because of this complexation of silver species which are present there. Now, I said to you earlier that, when we talk about nanoparticles, the focus is always on making things monodisperse. So if you have a size, you want it to be of a same size. If it's a shape, the shape should be similar. Surface chemistry, that should also be similar. But nowadays, what we are seeing is that there has been a lot of emphasis towards creating anisotropic particles. So for example, can you have an Janus particle whose one half is hydrophobic and the other half is hydrophilic? Okay, so can you create these amphiphilic type of nanoparticles? And these amphiphilic nanoparticles are very, very interesting and very, very important when it comes to theranostic device, because now what we can do is that we can actually create a particle wherein one half is hydrophilic, so it can get easily transported, and the other half is hydrophobic, so my drug can actually attach to that half. So I can have a particle which is doing the job of better biotransportation as well as better attachment to the drug. Okay. Now, I said to you earlier that when my nanoparticles go inside the body, it really encounters with a lot of different constituents. For example, they are inorganic, but they are often organic. And that leads to a very important area of research, which is called as protein and nanoparticle interaction. And there are a lot of work which has been done over there to find out whether a nanoparticle is having a preferential absorption of a particular protein. Because this is important. The reason is that once any material enters inside the body, the cells actually do not really see that foreign materials, but the cell will see a foreign material which is coated with that protein which is present over there. So in other words, we can actually cheat the system. If, let's say, we have created a particle which is supposed to bypass all this detection, and that can be achieved by attachment of that particle with a particular protein X, we can actually do that. So that's why a lot of these protein nanoparticle interaction studies has been extensively studied. And then the things like, hard corona, soft corona starts coming into picture, where what we are talking about is that proteins which are having a very high binding affinity with a particular surface will have a very hard attachment. And that's what we call as a hard corona. Whereas proteins which are abundant in nature, but they are not really having a preferential absorption, they would really have a soft attachment, and they can be called as a soft corona. Now, I think this session is supposed to be for an hour, right? So I've talked a little bit of nanoparticle, but I really do not want all of you guys to get fixated about nanoparticles. I really want all of you guys to have some examples of applications. Where are these applied? How can you help us, rather than us trying to get into the field of nanomaterials and understanding what the physics, chemistry behind it? Can you give me some examples where I would approach to some chemist and physics and collaborate with them to work on nanomaterials for your applications? So I'm going to give the next half of the study, next half of this presentation, all about some examples. So over here, we are talking about tissue regeneration, which is hard tissue regeneration. So let's say there is a patient who has undergone some trauma, and this trauma has led to a loss, and this loss is related to bone losses. Can we actually exploit the body's ability to heal itself and create these grafts which allows for bone formation? And this is a very interesting field of research which has been looked upon for the past 20 years, where they try to create these scaffolds. And what they do is that in these scaffolds, they try to have a certain type of porosity so that the bone cells can actually grow through it. And then these bone cells can actually mineralize and form those osteocalcin and then start the repairing. Now, depending upon the age group of the patient, this scaffold can stay there permanently, or these scaffold can actually dissolve. This is something which you probably would have come across in your courses also, where if let's say a person goes for getting a stent, and now then the question would be that, do you want a resorbable stent? Do you want a drug-eluting stent? Do you want a non-degradable stent? Now, the reason why these options are given is because there is a materials which is being allowed, which is being developed to allow this. So a resorbable stent is basically those stent which degrades with time. A drug-eluting stent are those stent where a drug has been adsorbed onto the stent so that you can have a periodic or a very sustained release. And if you do not want any one of them and you want a permanent stent, then those stents are made up of metals and they can actually be there till forever. Okay. So over here, I mean, if you look at the complexity of bone is actually a very good example of a composite where you have an organic component such as collagen, and you have an inorganic component which is in the form of, let's say, hydroxyapatite. And when these two things combine, you actually get the bone. And this bone is basically a very nice thermodynamic equilibrium between bone formation and bone resorption. Bone resorption. So bone is going to get always being formed through osteoblast, and the osteoclast will keep on eating it. Okay, so there is this fine equilibrium which happens, and that's why particular age group patients have more of osteoclast activity and less of osteoblast activity. So that's why you start seeing bone losses happening. And over here we have an example of a scanning electron microscopy image of a male human bone who is 22 years old, and let's say, and the same image from an osteoporotic woman in her 80s. And if you see, the density of this bone has reduced quite a lot. So in other words, there is more desorption which is happening as opposed to more formation. Okay? And this is where you can actually intervene. So to give you some examples, what can be done is, or what is the approach to solve such kind of problem, is that we look or we create an image of the site of defect. Once we create that image of a site of defect, then we try to create a prototype. And this prototype is where you use nanomaterials extensively. And then you implant it through surgery, and then you allow the body's ability to heal itself to basically promote the bone cell formations. Okay. So over here, what we tried to do is that we tried to find out what is the effect of using nanoparticles. Okay. So over here, for example, we tried to incorporate bioactive glass ceramics. Now, this bioactive glass ceramic is something which is analogous to hydroxyapatite in the bone. Okay, and this polymer is something which is analogous to the collagen which is in the bone. And what we find out is that by reducing the size of these fillers, you actually get a much better bone cell proliferation, you get a better adsorption, you get a better enhancement in strength, you get a better surface property so that the hydrophilicity and the surface energy is much more conducive for cell attachment. These all things are happening by changing the size of the filler from bulk to the smaller scale. So this is an example how nanomaterials can actually enhance the performance of an existing material which is used for tissue regeneration. And here are some examples of how the mechanical properties improve, how the protein adsorption improves, how the water contact angle, that's a measure of how hydrophobic or how hydrophilic your material is, that also gets improved. Okay. So these are some examples of utilizing those nanomaterials for biomedical applications. So what we did over here is that we created a scaffold, and this scaffold over here, if you look at the first image, the first image on, so the image on your left-hand side of the first image is actually a sugar cube. And what we did is that we used a salt leaching method to create a template of this sugar cube and then replicate it by putting some polymeric solution to it and then washing away the sugar, and what you're left with is a replica of that sugar cube. And if you look at the image of this in a scanning electron microscopy image, you see that you get a basically a very porous structure. And in this porous structure, these bone cells, which are colored in red color, artificially red color, they are happy to grow, they proliferate, and not only they proliferate, they differentiate, and they also do osteocalcin production, which is what these cells are supposed to do. And then we carry on with some subcutaneous, preliminary response. And what we see is that these scaffolds are actually eliciting a foreign body response as opposed to an inflammatory response. I mean, for the brevity of time, I'm going to skip this part and I'm going to talk about another example. Okay, and this example is very unique. So this is an example for anti-cancer applications. Okay, so there is a drug which is called as elesclomol, and what this elesclomol does is basically it's like a shuttle bus. So this elesclomol has a very high binding affinity with metal ions. So it could be copper, nickel, but preferentially it has a better affinity towards copper ions. Now what it does is that it binds with the copper ions, it traffics that copper ion into the cell, it dumps the copper ion inside the cell, and then it effluxes out. So the elesclomol will keep on doing this as long as there is a presence of copper ions or metal ions in your body. Okay? And what happens is that as a consequence of that, the reactive oxygen species or the ROS level inside the cell really increases, and that really kills the cells. And this is an approach which is used in the case of treating cancerous cells. Okay? Now, over here, nanoparticle is something which is used very nicely. So remember when I said to you guys earlier that these nanoparticles have the ability to dissolve. So what we can do is that instead of adding copper ions and elesclomol, can we actually have a reservoir through which copper ions are going to slowly keep on releasing, and my elesclomol is going to bind with it, take it inside the cell, dump it, come out, and keep on doing this as long as the copper ions are present. And over there, this strategy of using a nanoparticle has been very, very helpful. So I'm just going to show you some examples of that. So this is an example, an image of how these nanoparticles are getting internalized inside the cell through one of those endocytotic pathways. So if you look at the B image is actually an example of those, those cavulas which are being formed and through which your nanoparticles is going to get engulfed in, it's going to get trafficked inside the cell, it's going to dump out its contents, and then it's going to come out. So over here, what we see is that by taking these nanoparticles, we try to measure its ability to dissolve. And what we see is that these nanoparticles in biological fluid, they actually can have a dissolution all the way up to 100%. So if you look at figure A, B, C, and D, figure A is actually a deionized water analogous. Okay? In deionized water, these copper oxides do not really dissolve that much. So the dissolution is up to 20%. When we take artificial seawater is again a medium which is analogous to environmental application. And in artificial seawater, what happens is that these nanoparticles, they agglomerate because of a very high ionic strength, and they precipitate out. And as a consequence of that, you do not get a very high dissolution which is happening. So if you look at the dissolution or the dissolved concentration, it is less than 10%. But the same particles, when you put it in ALF is basically an artificial lysosomal fluid, which mimics the composition of a lung lining fluid. We see that these copper oxide nanoparticles can dissolve completely to the extent that you're getting 90% to 95% dissolution, which is happening. So which means that your nanoparticles are actually no longer there. And similarly, if you look at simulated body fluid is basically the inorganic composition of blood plasma. Okay, we are seeing that, of course, you do not get that high dissolution. You control the rate of dissolution, which is the slope of these lines. But nevertheless, the dissolution percentage is very, very high compared to deionized water and an environmental medium. So which means that these copper oxide nanoparticles can actually act as a reservoir of steady supply of copper ions. Because if you look at the time scale over here, the time scale is in the order of hours. Okay. So what we did is that we tried to attach these this LS-clomol to these copper ions because they have a very high binding affinity with copper ions. And then we tried to find out whether these are getting trafficked inside the cell and then really causing cell death. So what we did is we took an A549 cell model. A549 is basically a cancerous lung cell lines. And what we tried to see is by changing the amount of copper oxide nanoparticle, copper ions, and LS-clomol, whether we are actually getting a different cell viability. And what we see is that if we look at, just let me minimize the screen because these control buttons are hiding the icons. Sorry. So if you look at this figure A, 13A, we exposed the cells with various concentration of LS-clomol, which is the drug alone, just with copper oxide nanoparticles and just with copper ions. Okay, all these three things separately. And what we are seeing is that we are not really getting a very significant response from the LS-clomol at a very small concentration of 10 nanograms per ml. When you really increase the LS-clomol concentration up to 500 nanogram, 100 nanograms per ml, you are seeing a very significant cell reduction, which is up to 70% viability. But for us to have even lower than that cell viability, we really need to add more amount of LS-clomol drug, which is not really a viable thing because this drug is very expensive. But if you look at the copper oxide nanoparticles and the copper ions, at that concentration, the copper oxide and copper ions in itself are not really causing any cell reduction that significant. Okay, so which means that my carrier can be considered as a cytocompatible carrier. So then what we did is that we tried to combine the LS-clomol at different concentrations. So we took 1 nanogram per ml, 10 nanogram per ml, all the way up to 5,000 nanograms per ml. And we found out that actually you start seeing a lot of changes which are happening at 50 nanograms per ml concentration. So what we did is that we chose that as a concentration. Now, after that, what we did is that we tried to have a combination of this. So what we did is that we took copper ions, we took copper oxide nanoparticles, and we combined 50 nanograms per ml of LS-clomol with copper ions, 50 nanogram of LS-clomol with copper oxide nanoparticles. And the results were very, very outstanding. So what we found out that in the presence of copper oxide nanoparticles, the LS-clomol is having a very, very lethal dosage of cell viability. Okay, the cell reduction is happening, the cell viability is reducing significantly in the case when we are administering the LS-clomol drug and the copper oxide nanoparticles together. And the reason is because these copper oxide nanoparticles, they are releasing these copper ions in a very gradual manner, and this LS-clomol is binding with it and taking it away. Now somebody would say, so why are we not seeing the same effect for the copper ions? And the reason is because the copper ion is dumped all in one go. Okay. Now, once the copper ion is there, it has two choices, right? One is that it will bind with my LS-clomol. And the second is that it will complex with the media's composition. So if there is chlorine there, it will have a copper chlorocomplex. Now, my LS-clomol concentration is fixed, right? Whatever binding can happen, it has binded and it will go and take it inside the cell. Now, my copper ions or free copper ion is no longer going to sit there. It's going to combine with the other complexating agents, and it is going to precipitate out. When the LS-clomol comes out, it will see that I don't really have a supply of copper ions anymore. So it will not really be that effective. So in the case of copper oxide, because the release is very sustained, the efficacy of cell death is much, much higher. Now, we did a time-dependent toxicity studies also to that, and we really found out that within 10 hours, we are really getting a maximum amount of cell viability reduction. And that's again primarily because of during this duration, the dissolution of copper oxide is also maximum. So we further did some Ross quantification, reactive oxygen species generation, which is happening inside the cell. And we really found out that the fold changes are quite significant up to 4 hours. And that's where we realized that this method is actually working. So we are now going to do some in vivo studies on that and see how that works. Now, what we did is also that we used a new technique over here, again related to nanomaterials or nanotracing, is that how can you be sure that the copper which is going inside the cell is actually going inside? Can you prove that? Can you quantify the amount of copper which is inside the cell? Now, this is a very easy question to ask, but to actually perform it, it becomes very difficult. The reason is because there is always some amount of background copper which is present inside the body, okay? Or not just copper, any nutrient. So you have a trace level, nutrients level, you have a micronutrients, you have macronutrients. So there is always a background concentration. So in order to bypass that background concentration, what people do is that they increase the dosage. But that dosage is not really realistic. So what we want to do is that we want to minimize the dosage, whether it is of the L-esclomol or whether it is of the copper oxide. But to minimize the dosage, you'll always have a problem of distinguishing it from the background concentration. So what we did is that we tried to label these nanoparticles with a stable isotope of copper 65. Because it's stable isotope, it's not radiogenic in nature, so we can actually track it forever. Okay, to the extent that even if this copper 65 is going inside, the efflux of this, we can also measure that. So, and what we found out was, in the case of A549 cells, if we are just exposing our cells with copper 65 ions is also going through the cell, because remember, there is always this ionic channel pathway through which this copper can go inside the cell. And that is really causing a concentration of somewhere around 100 nanograms per ml inside the cell. When you take copper 65 oxide nanoparticles, now remember that the 65 copper oxide nanoparticles has two ways to enter inside the cell. One is through the dissolution, which is the ions, and second is the particles itself can also get internalized to the endocytotic pathways. Okay. But when we combine these copper oxide or copper ions with L-esclomol, we are actually seeing a very significant jump. And that is because this L-esclomol is acting as a bus and ferrying copper from outside the cell to inside the cells. And this ferrying is happening maximum in the case of copper 65 oxide nanoparticles. Okay, so this is just an example where what we are saying is that by changing the design of a nanocarrier, you can actually minimize the requirement of drug and have a maximum effect on the killing of the cell. So this is an example towards utilizing our nanomaterials for a biomedical application. I can flip it over and say that, you know what, I want to reduce the toxicity of copper oxide. So can I dope my copper oxide with some dopants, and that reduces the solubility, and that's also one way to look at it. So it's basically the two sides of the same sword. So I think for the case of time, we are going to stop here because it's almost it's 1 hour now. So just want to summarize what we discussed. So what? Yeah.
Sir?
Yes, please.
No, sir. Please go ahead, sir.
Okay. So what we summarized is that see, when we talk about nanoparticles, you have to understand that you as a designer, you have to create a nanoparticles with certain properties, whether it is optical properties, whether it is chemical properties, whether it is surface properties. Once you have created that particle with a certain properties, you then try to test its intended response. Okay, and in this whole process, always remember that the nanoparticle can act in two purposes. One is that it can be a passive carrier, which means it does nothing, or it can be an active carrier. Most of research nowadays are trying to utilize the combinatorial effect, and which means that it is trying to use the nanomaterials as an active carrier. And this example, which I told you about copper oxide, is an example where we are using it as an active carrier, where my copper oxide is attaching the drug, but it is also providing copper ions to increase the efficacy of that drug. Okay, so I'll stop over here and just want to let you guys know that the work which I presented today about L-esclomol is actually from my student called Swaroop, standing at the back. So it was his work. So this is my group. We are based at IIT Gandhinagar, and most of our work is in the area of bio-nanomaterials. So we are actually, just give me 1 minute, let me just mute this phone. So most of our work utilizes cellular response, and we are actively looking for students with the background of medicine, biology, chemistry, to take our research to the clinical level or even to the animal level. So I'll be happy to take any questions at this point of time, and yeah, so I can finish my presentation.